Hi, my name is Marco Merlo. I'm working as a clinical cardiologist and clinical researcher in the group headed by Professor Gianfranco Sinagra at Cardiovascular Department of Trieste, a referral Italian center for cardiomyopathies and myocarditis. Together with Professor Gianfranco Sinagra, Dr. Marco Anzini, Professor Rossana Bussani, Dr. Naveen Pereira, Dr. Joseph Bartonek, and Dr. Gerardo Finocchiaro, we wrote a review entitled Myocarditis in Clinical Practice that will appear in a next issue of Mayo Clinic Proceedings. The present review summarizes the contemporary knowledge about myocarditis, offering a rational and practical approach for the management of this polymorphic disease. Myocarditis is an inflammatory disease of the myocardium. It is a heterogeneous disease characterized by large variability in clinical presentation and evolution. An integrated evaluation of non-invasive investigation, clinical history, electrocardiography, echocardiography, cardiac magnetic resonance is fundamental for the identification of cases of suspected myocarditis, but the definite diagnosis of myocarditis is provided only by endomyocardial biopsy. However, even when performed by expert hands, endomyocardial biopsy presents a non-negligible procedural risk, and its accuracy is not 100%. Therefore, the diagnostic workup and clinical management of patients with suspected myocarditis should be tailored on the basis of the severity of clinical presentation and response to medical therapy. In this sense, important gaps persist between published recommendations and clinical practice. Guidelines for the practical management of the various manifestations of myocarditis are lacking. As implementation of current recommendation, we propose a practical and clinically oriented classification of myocarditis based on events risk of patients. Myocarditis have been therefore classified in low, intermediate, and high-risk syndromes according to the most recent evidences on prognosis. Clinical findings, both invasive and non-invasive testing, and appropriate management strategies, including follow-up timing, are proposed for each risk class. Patients presenting with chest pain and or supraventricular arrhythmias with preserved left ventricular function typically have an excellent prognosis. They are low-risk syndromes. Conversely, patients presenting with heart failure and or life-threatening arrhythmias, in particular when associated with severe left ventricular dysfunction or extensive late gadolinium enhancement at cardiac magnetic resonance, have a consistent probability of major clinical events in the long-term follow-up, and have a consistent and their prognosis largely depends on the short-term response to therapy. They are high-risk syndromes. Several cases exist with intermediate characteristics between low and high-risk syndromes. I am referring to patients with mild to moderate ventricular dysfunction, frequent non-sustained ventricular arrhythmias, persistent regional wall motion and or electrocardiographic anomalies, presence of significant late gadolinium enhancement. These patients merit particular attention both in the diagnostic workup and in follow-up because their prognosis is largely unknown. Invasive diagnostic testing such as endomyocardial biopsy and specific therapies like immunosuppression or in specific cases antiviral therapy should be reserved for patients presenting with high-risk syndromes and refractoriness to conventional therapies. Moreover, endomyocardial biopsy might be considered in some patients with intermediate syndromes. Finally, a structured follow-up is crucial for the management of all patients with myocarditis. However, the interval between each evaluation and the duration of the follow-up should be tailored on the basis of the severity of clinical presentation, the extent of ventricular remodeling, and the subsequent risk of events. Many fields of research on myocarditis remain unexplored and represent targets of future researches. In particular, studies on the pathophysiology, including the role of inflammasome, the prognostic stratification, for example in patients presenting with life-threatening arrhythmias, and therapy, including some new potential drugs such as interleukin inhibitors, especially in fulminant forms, represent only the most interesting fields to deeply investigate in the future. We hope you enjoy the reading and that our work may be useful for your everyday clinical practice.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.